Welcome, bachcho. Chalo, let's get started. Today, we're going to quickly go through some very high-yield topics. Stuff that's not just for your exams, but for your everyday life in the clinic. So pay attention.
So here's our plan for this quick explainer. We'll start with a clinical mystery, the disease of the 3Ds. Then we'll look at a vitamin with some tricky drug relationships. After that, we'll talk about the glue that holds your body together, vitamin C, then shift to how your body's army learns to fight, and we'll finish up with a quick look at vaccines.
Okay, before we dive in, here's a puzzle for you. Imagine a patient walks into your OPD. He's got a nasty skin rash. He's got diarrhea. And he seems, well, confused, a little demented. So, rash, diarrhea, dementia. What is the one diagnosis that should be screaming in your head? Just think about it.
Did you get it? The answer, of course, is pellagra. And pellagra is caused by a deficiency of niacin, which you know as vitamin B3. This triad of symptoms, it's a classic picture, something you absolutely cannot afford to miss.
So why is niacin so important? What does it even do? Well, it's a key part of two incredibly important coenzymes, NAD and NADP. Just think of these as the tiny batteries that power every single cell in your body. They run everything: energy production, breaking down sugar, making fats. Without niacin, the batteries go flat. Simple as that. And this is the slide you need to burn into your memory, the classic 3Ds of pellagra. First, you get dermatitis, a rash that looks like a bad sunburn on any skin exposed to the sun. Second, diarrhea, which can also come with a painful, inflamed mouth and tongue. And third, dementia, confusion, memory loss. It can get really bad. So say it with me, Bacho. Dermatitis, diarrhea, dementia. Never forget it. Now here's a clinical pearl for you. Who is the patient you are most likely to see this in? A chronic alcoholic. And why? It's a double whammy, really. First, their diet is usually terrible, so they aren't getting enough niacin to begin with. And second, the alcohol itself messes up their gut's ability to absorb whatever little niacin they do eat. It's a perfect storm for deficiency. Okay, let's move on. Next up is vitamin B6, or pyridoxine. And here we're going to focus on something very important and a favorite question for examiners. Its very tricky relationship with certain drugs. So listen up. What you have to understand is that this is a two-way street. On one side, you have a drug like isoniazid, a very common anti-TB drug, that actually attacks vitamin B6 and causes a deficiency. Your treatment is creating a new problem. But then, on the other side, B6 itself can interfere with other drugs. Take levodopa for Parkinson's disease. If you give B6 with it, the B6 helps break down the levodopa in the body before it can even get to the brain. Not good. But here's the clever part. We can use this knowledge to our advantage. Since we know isoniazid causes B6 deficiency, what do? We give the patient pyridoxine right along with the TB medication to prevent the nerve damage. You see, we're using the vitamin to fight the side effect of the drug. It also has other important uses, like in some anemias and even for seizures in babies. All right, next up is a vitamin everybody thinks they know, ascorbic acid or vitamin C. But let's move beyond just thinking it's good for a common cold and look at why it's so critically important for the body. I want you to look at this quote. This one line is the key to everything about vitamin C deficiency. Symptoms stem primarily from connective tissue defect. If you understand this one sentence, you understand the entire disease of scurvy. So why connective tissue? It's all about one protein, collagen. Collagen is like the cement that holds the bricks of your body together. It's in your skin, your bones, your blood vessels, everywhere. And vitamin C? It's the absolutely essential ingredient needed to make that cement strong. Without vitamin C, the cement is weak and crumbly. And what happens when that glue, that cement, starts to fail? You get scurvy. The signs are exactly what you'd expect. Your gums, full of connective tissue, get swollen and bleed. The tiny blood vessels become fragile, leading to these pinpoint bleeds under the skin we call petechia. Wounds don't heal properly. It's all because the fundamental structure of the body is falling apart. Okay, we've talked about the building blocks of the body. Now, let's make a big shift and talk about the body's army, its defense system, our immune system. How does it work? How does it learn who the enemy is and how to fight them? This is where we get into the principles of immunity. First, we have active immunity. The name says it all, right? the body is actively involved. It gets exposed to a bad guy, an antigen, either from an infection or a vaccine. It sees this enemy and it says, okay, I need to build a specific weapon against you. And it does. It makes its own antibodies, it trains its special forces, and most importantly, it creates a memory so it can fight faster next time.
Then you have the other type, passive immunity. Here, the body is, well, it's passive. It's not doing any of the work. You are getting a dose of ready-made antibodies that were made by someone or something else. Think of it like hiring mercenaries. They are highly effective, they work immediately, but they are just visiting. They'll do the job and then they'll leave. They don't teach your own army anything.
So the crucial point here is the trade-off, speed versus staying power. Active immunity is slow to build up, it takes weeks, but it's long-lasting, sometimes for a lifetime. Passive immunity is immediate, it works right now, but it's gone in a few weeks or months. So, you have to choose. For preventing measles for life, you need your own army, that's active. For a snake bite, you need help now, so you use passive.
So that whole idea of training your own army, of building active immunity, what is the safest and most effective way we do that in modern medicine? You all know the answer. It's vaccines.
Now, not all vaccines are made the same way. Think of them as different training programs for your immune army. First, you have killed vaccines, where you show the army a mugshot of the dead criminal. Then there are live attenuated vaccines. This is like a sparring match with a weakened but still living opponent. And finally, you have toxoids, which is really smart. You don't show the army the bacteria at all, just the weapon it uses, its toxin, but in a detoxified, harmless form.
And this explains why they work differently. A killed vaccine is just a picture, so the immune response is good, but it might fade. That's why you often need booster doses. But a live attenuated vaccine, that's a real, though very weak, invasion. The body mounts a massive, powerful defense, and the immunity it creates is very strong and long-lasting, often for life. So I'll leave you with this thought. From the vitamins that fuel our cells to the vaccines that train our immune army, we have the tools. This knowledge we've covered today is not just to pass exams by Cho. This is the toolbox you will use for the rest of your lives to heal people. The first step is understanding. The next is applying it. The question is, what will you do with it? Well done today.